Hello, my name is Fran and I am one of the community district nurses that works alongside this surgery. I'd just like to talk a little bit about the typical day in the life of a district nurse. Our day usually begins by visiting diabetic patients at home to administer insulin and carry out blood glucose monitoring. Often these patients can be quite vulnerable and do rely on social care input to provide meals and personal care needs. This is often carried out at specific times of day, so we work quite closely with the carers in order to administer injections around meal times and promote and maintain good glycemic control for our diabetic patients. We then move on to planned and routine visits, such as wound care and post-operative care. We may be asked to go and see a patient that's sustained a fall and has got a superficial injury that just requires a simple dressing, or we could be treating and assessing something more complex such as a leg ulcer or a non-healing surgical wound. The district nurses also carry out routine catheter care and continence management. We administer injections, we take bloods, we carry out blood pressure monitoring. We also risk assess for falls and pressure sore prevention. Another aspect of our role is health promotion and health education. This can enable patients to become more autonomous in their decisions regarding their health and hopefully positively affect their health status. District nurses look after patients with chronic and long-term conditions such as diabetes and cancer. This includes patients with palliative and end-of-life care needs. We also manage and treat patients with chronic and long-term conditions such as cancer and diabetes. This includes patients that have palliative care needs, so from diagnosis of a long-term illness such as cancer, we can provide treatment, observation and support right the way through up until end of life. At end of life, we provide, for a lot of patients, the preferred place of care is at home, so we can support families and patients to end their life at home with dignity and care. Often the work the district nurses do is very varied and can be multifaceted. For example, we may receive a referral from the hospital to ask us to go and visit a diabetic patient that, for example, has had a below-knee amputation. On assessment of this patient, there is many factors that we need to be looking for, such as does the patient live on their own, are they able to manage, are they accessing services such as physiotherapy which can help promote recovery, can they manage the diabetes, do they understand the medications that they're taking, they may also have a wound that we need to attend to. The district nurses provide care in a variety of community settings. We've talked a little bit about home visits. We also visit patients in residential care, but we also run daily clinics. These clinics are intended for patients that are up and about and mobile patients who can come in to see us. These clinics are run at Union Street in Hyde, Hattersley Health Centre and at Ann Street in Denton, and your GP surgery can provide you with the contact numbers to make an appointment. We find the clinics are ideal for patients, like we said, that are up and about. Often when patients are waiting for a home visit, we have to prioritise our care and our workload, so sometimes patients might be waiting all day to be seen by the district nurses, whereas in the clinics they can come and see us at an appointment's been given. When we receive referrals, we get them from various sources such as the hospital, GPs, Macmillan nurses, social services, carers. Patients and families often can self-refer as well. Our referrals should be put in writing, but this isn't always possible, especially for patients that are self-referring, so we do accept telephone referrals. Once we receive a referral for a patient, they're all assessed and triaged, and an appropriate and timely appointment is then given. District nurses work very hard to provide a wide range of services in the community which respect individual choice and need. We strive to provide a high quality and responsive service which has dignity and care principles at the very heart of the service. Thank you.